Skagit Regional Health is committed to excellence in training the next generation of physicians. Coming up, a closer look at the medical residency program. This is Be Well with Skagit Regional Health. I'm Cheryl Martin. Joining me is Dr. Julie Merriam, the Family Medicine Residency Program Director. Welcome, Dr. Merriam.
Thank you.
Doctor, what is a medical residency program?
Well, that's the clinical training for physicians who've just graduated from medical school, and they've chosen a specialty field to go into. They're called resident physicians or resident doctors, and the name resident is interesting. It started years ago because the doctors actually lived in the hospital that they were working for.
So what types of residencies are offered at Skagit Regional Health?
We have a family medicine residency and also internal medicine residency here.
And how long do residencies typically last?
Well, both family medicine and internal medicine are 3-year programs, but that's not true for every specialty. Some are a little longer than that, depending on the specialty. Typically, the primary care residencies are the shortest. And after residency, the doctors have an option to go on for fellowship training, which adds another year or more.
So what are the benefits to the community of Skagit Regional Health offering a residency program?
Well, teaching in a residency program really helps to keep all the current physicians up to date on the latest medical information. And they really, a lot of times, look things up if they're trying to explain things to a new physician. This can be really fun and sometimes challenging when we're looking up the latest medical research or reading recent articles together with the trainees. We do that a lot when we have patients with really complex needs. It's a great way to give back to the medical community and recognize that other physicians have trained all of us. It's really rewarding for both physicians and staff when we see our residency graduates working in our community and knowing that we were a small part of their training.
And how many residents will you typically take a year?
We take 4 every year in the family medicine program, so we have a total of 12 since it's a 3-year training. And in our internal medicine program, we take 6 per year for a total of 18.
You talked about the benefits to the community offering a residency program. So how is an appointment with a resident physician compared to an appointment with an established physician?
Well, it's actually really similar with a couple differences. In our clinic, because it's a training site, we do have both resident physicians and medical students that we train. So a patient during their appointment might see both of those. And then the biggest difference is that everyone still has to be supervised by an experienced physician. So a lot of times a patient will also see the supervising physician at the end of the appointment. Sometimes the supervisor comes in to gather more details about something or to repeat a portion of the physical exam, but lots of times they just come in to verify the plan with the patient and answer any additional questions. It's an aspect that a lot of our patients enjoy because they feel like they have the benefit of 2 physicians putting their heads together to make a plan for the best care for them. And some people really, really enjoy being part of the training of the next generation of physicians for our area.
Is it a goal that resident physicians remain in the community after graduation? And if so, how many usually take that option?
Yeah, it's a big goal for us because we are in an area where we need a lot more physicians. Typically, over the years, about half of our residents have stayed in our community. This summer, the residents who graduated made us really lucky, and all 5 of our graduates are working in this community.
Great.
Yeah.
Anything else you'd like to add about the program or why a medical graduate should apply?
We're a program who is really proud to be in this community. We have resident physicians who are working every week with community partners in our area, and we try to find where there are needs and see if we can meet them. So, for instance, our residents each week work with Community Action of Skagit County or the Skagit County Health Department. There's a local organization called Friendship House, local schools. We try to really focus on where we can get into the community and fill some needs.
How far in advance should a medical student apply to your program?
Actually, there's a really structured application process for medical students in the 4th year. Some have an opportunity to come here and do what we might call an audition rotation or a sub-internship, and they typically would contact us the spring before that. But there's an electronic application service that all medical students would know about, and that's how they would actually apply for any residency program nationally. Right now, we're actually in the season where we're accepting applications for next summer start date.
Great.
Yep.
Well, Dr. Julie Merriam, thanks so much for giving us an inside look at Skagit's medical residency program. Much continued success.
Thank you so much.
And if you'd like to learn more, just visit SkagitRegionalHealth.org. That's SkagitRegionalHealth.org. If you found this podcast helpful, please share it on your social channels. And thanks for listening to Be Well with Skagit Regional Health.